welcome back. A recent study by researchers at the Children's Hospital at Montefiore found that children with asthma experience extended hospital stays when exposed to higher levels of air pollution. This study is extremely relevant following the recent wildfire smoke that covered New York City, exposing New Yorkers to high levels of unhealthy air quality. Joining me to discuss this finding is a medical student from the Albert Einstein College of Medicine, Jennifer Hardell. Jennifer, thank you so much for joining me.
Thank you for having me.
So we're talking about asthma. As many of us know, it's a common health condition in this country affecting millions of people. But can you just talk about how asthma affects children in comparison to adults?
Yeah, asthma is much more common in children. In fact, it's one of the leading causes of emergency room visits and hospitalizations all over the country. Children's lungs are especially susceptible to damage, and that's why many children develop it. But luckily, about 2/3 will outgrow these symptoms as they grow up, so that's why it's less common in adults.
Oh, okay, I didn't know that you can outgrow that, so
Yeah.
Thank you so much for sharing. Now, can you tell me about the study led by Dr. Elissa Gross that you were a co-author on that examined how children who experience asthma recently face more frequent and longer hospital stays?
Dr. Gross and I treat patients who are hospitalized for asthma, and it happens unfortunately very often. In this study, we analyzed about 2,000 medical charts of children hospitalized for asthma here at CHAM in the Bronx, and we looked also at the amount of pollution that they were exposed to just prior to their admission. And we found that children that were exposed to high levels of pollution actually stayed in the hospital longer. So, for example, we looked at this certain size of what's called particulate matter, something we call some forms of air pollution, and we also call it PM 2.5, if you ever hear about that. And they're tiny pieces of solids or gases that are created by smoke from vehicles or factories or wildfires. And what we found was that while the average length of stay for these children was about 2 days, for every elevation of this PM 2.5 by 10, the hospitalization actually was extended by a quarter of a day, about 10%. So as you can imagine, with more and more pollution, a quarter of a day turns into a half a day, and that can have real impacts on families.
Now, our city recently faced intense poor air quality. How did this affect those with and without asthma?
Yeah, when the smoke rolled in, we could really see that particulate matter. But it's important to notice that especially the Bronx, but many places have air pollution that we can't see. And so the Bronx has a lot of air pollution from the vehicles and highways. But with the wildfires coming in, we could actually really see it. And I mean, that level of air pollution is not good for anyone's lungs, but especially children with asthma. It really affected them. And anecdotally, me and my colleagues at the hospital, we really think we saw more hospitalizations, more symptoms, and even children were coming in with pretty mild asthma that needed to be hospitalized.
Now, you mentioned that it's just more prevalent in the Bronx where we see this poor air quality. It seems like we all share, one city, but why are we seeing this in the Bronx?
Asthma is about 3 times more common in the Bronx than elsewhere. For instance, in the rest of New York City, or the rate in the Bronx is about 17% of kids have asthma. In New York City, it's about 11%, and in the country, it's about 5.8%. So there are lots of interconnected factors that are hard to piece apart, but the Bronx has really high rates of smoking, mold, pests, excess weight. All of these are risk factors for asthma, but a big one is air pollution. I mean, the Bronx has the worst air pollution in the city and the state, and that likely plays a huge role.
And I understand it has like the worst, I believe, federal air quality. Can you just expand on like what that is?
Just compared to the rest of the country, the air quality in the Bronx is much worse, probably due to a lot of the highways and things that are in the Bronx and distribution centers for the city.
Now, I want to talk about something that I think we don't really think about when we talk about like children that are hospitalized, and it's their development and how it affects them just mentally and possibly their families as well. Can you expand on, how these longer hospital stays can affect a child's development?
Yeah, so when asthma gets really bad and a child's hospitalized, obviously that's really scary for their parents, for them. And when they stay in the hospital longer, that means more absences from school, less activities they can do, less time with their families. And over 13 million school days are missed across the U.S. from asthma, and it's been shown that kids who have uncontrolled asthma do worse academically due to all of these absences. So it can really have an impact academically and socially.
Now, what are some other factors or social determinants that can contribute to this?
Yeah, socioeconomic status plays a huge role in so many health conditions. We see it every day at the hospital, unfortunately. And many people without wealth don't have the money to afford to live far away from highways and other things that create this air pollution. They may live in older apartments that have that are more prone to mold and pests, and they may not have air conditioning so that they can stay inside on those bad pollution days. They may not have access to parks and other green spaces they can go to that help filter the air. But this is just one example of many where people of lower socioeconomic status bear the brunt of all the pollution and other environmental impacts of human activities. Yeah.
Now, I also like that we're talking about this because I think a lot of times in healthcare, people think that you can determine, what your health outcome is. And we see that that's not always the case. And this is pretty much a public health issue. What should be done, or what do you think could be done to ensure that people throughout the city are getting better air quality?
This is very tricky, and there's a lot of research, and honestly, there should be more put into this. We need to think about environmental policies that will help everyone. For instance, I know there's been talk of recently congestion pricing, meaning putting a toll on cars that go in the busiest part of Manhattan. But research has shown that actually that will increase pollution in the Bronx because more cars will bypass Manhattan and go through the Bronx instead of Manhattan. And so I think it's important that we do research and really develop smart policies that really take into account those already most impacted, like people here in the Bronx.
Now, while hopefully people do work towards that, what can people do in their homes to better the air quality, especially for those who have family members with asthma?
Yeah, it can be really hard because it feels like a lot of this isn't under your control. What can we do? But there are some things you can do. There are a lot of things that can trigger asthma, and the first thing is to really look at your home and make sure that we mitigate those things. So for instance, fires, gas stoves, cigarette smoke is a big risk factor. And as I said, mold and pests, all of those things can trigger asthma. And then if you're worried about air quality, like it's really bad outside, you can get pretty cheap air filters that can help filter the air. And you can honestly make it with a really cheap air filter and a box fan, but just make sure that you change that regularly to make sure it's still filtering the air. When you do go outside, and I'm sure many of us saw this with the wildfires, there are resources that we can look at to see what the actual air quality is outside. Even just your weather app on your phone will tell you, or EPA's airnow.gov will tell us what the pollution is outside. And if it is bad and you need to go outside and your child or someone in your family has asthma, make sure you have their medicine on you, the rescue albuterol inhaler that they can take. And also an N95 mask can also be helpful. But Montefiore has a renowned asthma center that can really help develop a plan that's perfect for your family that hopefully can help prevent a hospitalization.
All right, well, Jennifer, I want to thank you so much for joining us and educating me and our viewers on this.
Right. Thank you so much for having me.
To keep up with all the amazing work the Children's Hospital at Montefiore does, please go to their website at www.cham.org. Stay tuned, we have more open for you right after this.